CENSEC was the partner in the project, the lead partner in Cuba, and CENSEC is the Spanish acronym for Centro Nacional Coordinador de Ensayos Clínicos, which in English is the National Coordinating Center for Clinical Trials. It is the national body that conducts, manages, and designs research trials, everything from cancer to psychiatry. Dalhousie and CENSEC worked together for 6 years to conduct the Psychopharmacological Training and Research Capacity Project in Cuba. The goal of the project was to strengthen Cuba's capacity to conduct, manage, and design psychiatric clinical trials. Before the project, standardized instruments and diagnostic methods were not commonly in use, so different practitioners would use different types of methods or different ways of recording diagnosis. With the introduction of clinical trials methods, clinicians are starting to realize the value of standardizing diagnosis and recording information from patients so that when one clinician looks at a chart and another clinician looks at the chart, or if a nurse looks at a chart one day and a doctor looks at the chart the next day, the information is exactly the same among all the healthcare providers, and the information being collected from each of the healthcare providers is standardized. When the training was developed and the human resources capacity was developed, the next phase of the project was then to market that capacity to conduct, manage, and design clinical trials. So that was in the latter phases of the project with some promotional activity took place, as well as we were also promoting CENSEC's capacity to conduct training in the conduct and management and design of clinical research with the ultimate goal that they would be a training center for Latin America.
The government of Cuba had created as one of their health priorities the capacities to develop and test their own pharmaceutical products. They also realized that in order for them to become part of the global network of research, that they had to be able to show that they had the capacity to participate in the research projects. And so when we arrived in Cuba with the expertise that we had, it was a nice fit because their directions were moving in a manner in which we could offer the competencies that they needed to develop. So it was a nice fit between what we had and what Cuba needed to develop.
The project was successful because both partners got together at the onset in order to develop outcomes that were in keeping with Cuba's priorities. We had frequent meetings. The other thing is that we ensured that the actual education program was tailored from a cultural perspective, and also we had both in Cuba as well as in Canada a huge commitment from the participants and also a huge motivation.
There are a multitude of factors that make any project successful, and this is no exception. But I think that there were 2 or 3 key factors for this project. One was that the individuals that were involved in this project were highly, highly committed to ensuring that the project was a success. The amount of work that this takes, the complexities of the work, the complexities of the language differences, were all overcome by the hard work and commitment of the individuals on both sides to the project. I just can't say enough about how wonderful everybody was.
The Cubans learned English, Canadians learned Spanish, and as we started communicating better, we were able to ensure that we met our timelines as well as our goals.
I think the second thing that really was important for the success of the project was the support of the institutions here at Dalhousie University and at the CDHA and at the IWK, in which staff and faculty gave freely of their time, gave freely of their expertise to provide the kind of interventions and training that the project needed, and they were just magnificent. And the third thing that was really essential for success was the financial support that we received from the Association of Universities and Colleges of Canada, CETA, through the Tier 2 project funding. These projects are not inexpensive, and the funding envelope that we received was at the level that is necessary to drive this kind of project through. So I think those were three key factors.